People see a lot of good healthcare system, especially in the Western countries, right? They're exposed to it. They would like to experience some sort of a similar thing in Sri Lanka as well. A lot of people in Sri Lanka goes to Singapore to get their surgeries and thinking that they have better healthcare system abroad. But here in Sri Lanka, I mean, like our doctors are like hands down like one of the best doctors in the world. What I see is basically patients struggling to find good healthcare system where like they want to see the doctor for like a basic primary care issue. They need to like take the entire day off from work. I feel like in the Sri Lankan healthcare system, there needs to be kind of like, approach and make it better. Even the surrounding when a patient comes into a clinic or a hospital, making sure they're in a very comfortable environment. Those kind of like minor things kind of like goes a long way, because when we all get sick, we are all stressed out, and we want to like make a surrounding when people come in like they're like, okay, like this is like a safe place, and basically the interior is nice, and I feel like I can come here more often. That's something that we found in the Sri Lankan healthcare system that can be done better. We normally have our doctors spend about 20 minutes with each patient, and we wanted to build that relationship with the patient and doctor and make them comfortable, and especially also the clinic aspect of it, making sure that they're comfortable in a clinic space as well. That is one aspect of the things that Vida is addressing. The other is the aging population in Sri Lanka, where like there's a huge aging population in Sri Lanka currently, and they need proper home care. Like not all elderly people can like go to a hospital or like a clinic or anything like that, because they might be immobile, or it can be something a big task for people in that age. So that's why we want to tap into that the home visit sector as well, which has been doing quite well actually, just because we are service oriented and we get all those aspects like tender loving care, where like when the nurse patients, when they come in, they see the doctor, and like we address it in a more like a approachable manner, very kind manner. The other one is the ambulance service, which goes hand in hand to the home care service basically. So we have ambulances that is running for emergency care. Around in Colombo, we have done a couple of transfers from Jaffna to from Trinco to Jaffna to like all around the island. So that is the approach that we are trying to do. So that's something that we are tending to, like the in-house consultation, the home visit, and the emergency care, the ambulance transfers. If we consider the Vida in-house consultation, it's all about primary care. For primary care, there are niche market basically in Colombo. They would like to come on time and get their things sorted out from there. Our doctors are also like in it, like we have quite a number of GPs and primary care specialists that is practicing at Vida. So the accessibility for primary care is there at Vida. So, and that also goes with the elderly care home visit aspect as well. Even though that they don't come to the clinic, we go to them, and that is something that we also do. So yeah. If you have a good experience anywhere, right, they will come back again. And it goes from the receptionist, the person who's answering the call, to the reception, to the nurse, to the doctor. Those are the aspects. So like, we do not want quantity per se, we want quality. And if you come to Vida, especially in our clinic, you don't see about like 20 people in line to see a doctor. You will maximally like, see about 6 people in the lobby area, because we tend to give that 20 minute space for each patient, and the doctor is already there talking to them and having a connection with them as well. So those kind of things, we look into. It's not about quantity, it's all about quality at Vida. And we always get constant feedback as well from the patient. It can be like a phone call, it can be a review on Google, it can be a review on any social media. So those kind of aspects I've personally seen like people talking about, especially on the elderly care side. Like And I have a couple of friends who obviously like the Vida team came and took care of my grandfather. It was great. The service was great. Those kind of comments that we would normally intend to get. But of course, like, we are open for criticism. I mean, like, we would like to be 100%. I'm not saying like there might be margin for error, but like we would like to get that criticism back as well. So that's how we learn, how we grow, how we can address our operations as well. We have a clientele from people who come for general physician primary care to sexual health, mental health, things like that requires privacy, a little bit of, making sure like they are taken care of them properly. For all those aspects, we always constantly reach out to our patients, be like, hey, like, how can we make ourselves better? Like, was there something wrong with the doctor? Was there something wrong with the nurses? Was there something wrong with the person who answered the call? For that nitty-gritty things, we look into those kind of things. That sort of thing we've been doing that for the past 3 years. And it can be a tiring job at first, but like then we see results. People see a lot of good healthcare systems, especially in the Western countries, right? They're exposed to it. And they would like to experience some sort of a similar thing in Sri Lanka as well. A lot of people in Sri Lanka goes to Singapore to get their surgeries and thinking that they have better healthcare system abroad. But here in Sri Lanka, I mean, like our doctors are like hands down, like one of the best doctors in the world, I would say. If a patient comes into Vida, we expect our doctors to like actually take 20 minutes and like, talk to them, get to know them as people or person, not as a patient, like as a person, to talk to them, maybe get their family history, maybe something that they can find, help their diagnosis. This is something that we came up with, so which is like a huge plus point. That is something significant about Vida is that 20 minutes to 30 minutes that they take with the patient, right? And that kind of helps a lot and kind of like retain the business as well, because like, they would come in and like talk to the doctor and they will feel great. They will go and talk to their friends about it, and that's how that works. We were just completely targeting the young doctors because we knew like they kind of understood the business model, what we're trying to do, what is the future of it. After that, there've been like a lot of doctors coming into Vida who wants to consult. They go through a little bit of a process of like, I don't want to say interview, but like they go through a small chat between myself, Dr. Galapati, our management team. Like they go through the whole thing. Just a easy way to like say like, the main thing again, punctuality. You can come on time, That has been a little bit of a issue for some people, some doctors, but some doctors like it and they comply with it. And those kind of small things, even for the nurses, the drivers, we make sure like they're very well experienced first and also easy to interact with the patients. Those kind of things. Any corporation, how they retain talent is build a culture, right? Monetary value is there, of course. And build a really good culture where like, they want to work, they want to contribute as well. It's not like, you're being a doctor, just do your doctor things, or you're being a nurse. No, we get everybody's ideas in. We have retained a couple of people without going abroad and staying here. It's again, going back to the culture. You need to wake up in the morning and think, hey, like, oh, I'm glad to go to work because like 8 hours a day I'll be spending at work, and I'll be coming back home in the night to sleep. That 8 hours, you need to build a really good culture. If you can build that, that would be like just, for anyone, but like, it'll be great because like, those are the pointers. I mean, like monetary value, you cannot like, what you can get from abroad is different what you can get in Sri Lanka. And it's a huge challenge, not gonna lie. It's a huge challenge how we can retain talent, because there's a huge monetary value for any of these medical professionals being highly demanded in the Western world. I worked in the US, like I got exposed to the Western corporate culture there. And I was working in HR as well. So like totally focusing on like HR and people's culture at work. So kind of took some pointers over there from that side as well. Kind of experimented that here at Vida because it was a startup, and like, experimenting things like that would, see what's going to come. Most of the doctors or any other, I would say, professionals who have been here in Sri Lanka and worked here in Sri Lanka hasn't had that sort of exposure. So we kind of put that, and like, it kind of worked actually, it's like People don't have their own job role. Everybody's like, contributing to the management. Everybody's contributing to the operation. It doesn't matter whether you're a locum doctor or a full-time doctor. We're all contributing. We're welcoming, ready to take ideas, making that workspace better, which is, I find it a huge thing. Preparing that workspace for our doctors and our management team, retreats and things like that kind of really helped bond with the doctors and basically the medical side and the business side, I would say. Because I feel like in most organizations, they are a little bit, okay, you're going to do the medical part, we'll do the business part, and they're not intertwined. That is something I saw as well. So we want to break that barrier and make sure, like, make that culture where, like, you're open for your suggestions, and we are here. So Vida has been getting quite a number of foreign patients as well. And they like it just because they find the convenience, the environment, especially in the clinic, and the people who are like doing the service. They like that aspect. Something that I am passionate about is medical tourism. Just living in the States, I've seen people just, for healthcare is something big in the Western world. Like, if you don't have a job, like you don't get insurance, you can't go afford healthcare, basically. But in Sri Lanka, we have free healthcare, which is amazing. And like, to promote the medical tourism is something huge that Sri Lanka needs to tap into. I know some key players have already started in that avenue. And like, we are also like already started our foundation on that as well. That is something that we really want to get into. Like primary care, basic primary care dental work can hugely impact income for the country as well. Sri Lanka is known to be a tourism hub. Just imagine one person getting all their blood work, all their MRIs, all their scans coming to Sri Lanka, having top-notch healthcare in Sri Lanka, and next few vacation days going around Sri Lanka, right? Those kind of aspects we have seen, and I think medical tourism is something huge for Vida, and we are already working on it. And the other thing is that, again, aging population in Sri Lanka is high, and we are also thinking about some along the way of getting into a retirement village, retirement community under the Vida flagship. Jaffna has a huge aging population. Private healthcare is not as much as we wanted to. So we wanted to so the people in Jaffna as well, help the elderly people over there as well. And as well as the expat community living down south, in Gaul particularly, to have these kind of services, not only on Colombo. We have people actually, to be quite honest, I think we had people coming from Jaffna to Vida. We had people, tourists coming from Ella to Vida, Gaul to Vida. There have been some people have traveled from different parts of Sri Lanka just to get into Vida and get a consultation with our doctors just because of the service and the things that we are promoting on. So that is something that is